Bienvenidos otra vez a nuestra brigada que año con año, ¿verdad? Estamos apoyándoles a ustedes.
Everybody else is going to come to me and I'll tell you guys what we're going to be doing once we get up to the floor.
Nosotros ahorita vamos a ser evaluados todos los pacientitos.
We're screening, I think, over 70 patients today for potential surgery.
En arriba, cuando pasen con los médicos, van a pasar por varias consultas.
Some of them are traveling from 6, 7, 8 hours away with their families. ¿Dónde duele? All over in the front.
Just to come to see if they are even eligible for surgery. So they made this whole distance trip just to maybe be told that they can't.
Y entonces, ¿tú has estado esperando ahora para las rodillas 6 años?
6 años en proceso. 6 años. Pidiendo al Altísimo que vive arriba.
When you hear how long they've been walking or not walking like that, not being able to do any daily activities in general, it's shocking.
This is as far as his knee will bend. There, that's all. And it will only straighten out here.
Their deformity and their arthritis is so advanced that they just can't tolerate the pain anymore, and they have no way to treat their conditions in this country.
¿Pero no tiene alergia? No.
In the entire country of Honduras, they do about 500 joint replacements a year. Just to put that in perspective, in the United States, we probably do over 2 million joint replacements a year. If a patient in Honduras wants to have a joint replacement, they have to pay out of their pocket at anywhere from $8,000 to $10,000 just to be able to consider having a joint replacement. And we're talking about an average income in Honduras of people living on less than $100 a month. So it's almost impossible for them to have access.
They are told to push on as much as they can, and they have to work hard for their families day to day. And then you see it when it gets too far, when they can't walk.
She has rheumatoid arthritis.
The only thing I want is seeing my mom, enjoy her life. In past 7 years, she was not able to enjoy life as she wanted to because she's been in a harsh pain on her knee. We would spend so much money in pain medications, and sometimes it would just help her for a few hours. And it was very harsh to see your favorite person in pain. I would see it in her face that the pain would drain her so much.
It was an amazing day. The teamwork of all of us working together was just amazing.
Getting to know the equipment on day one is paramount to success. And wow, this year, within a half hour of us running from room to room and helping each other out, it was a blast getting to know this equipment and getting it to work and getting it up and running.
Even though we all have roles in our day-to-day lives, we kind of meld our roles, and everyone just pitches in to do whatever is needed to take care of these patients. And then there's the patients.
These people have heart. They put their trust in us. Like, wow.
When you ask these patients what are they wanting to get back to, and they just want to play with their grandchildren, with their children. They want to be active again.
We're here at Operation Walk, and we're putting in knees. We're putting in lots of knees.
There's a long wait list, so people have to wait years and years with deformities and pain.
Ni una cuadra caminar, ni una cuadra. Andaba con bastón y no caminaba ni una cuadra.
This is their last hope. They're incapacitated to the point where they can't work or feed the family or take care of the family at all.
Yeah. Perfecto.
Care here is top-notch. It is exactly the same as we would give anyone in the United States. There's a tremendous amount of attention placed on details.
We do everything the same way we would back home. So as far as safety goes, as far as having everything anyone would need for emergencies, for backup on backup plans. We have everything for airway equipment, emergency equipment, medications. We have implants that the reps bring. all of the knee and sometimes hip equipment and supplies that we would need to do everything, not only before surgery with the floor, so IV fluids, all of that stuff during surgery, of course, and then also once they leave the OR in recovery, so what they would need, walkers with PT and everything that they need there. So it is quite a lot of stuff, but everything that's necessary to do this surgery as perfect as we can for them like we would back home.
Everything that we do is 100% free to the patient and their families. It's 100% covered by donations. So all the cargo, all the man hours, all the work we do during this week, 100% voluntary. And it's only possible because people from around the world, really, but especially back in the United States, support us monetarily.
We couldn't do it without the sponsors. I believe one patient last year told us that he would have to work for like 60 years and save every penny to be able to afford to have a total knee replacement, versus in the US, we have insurance to pay for it.
It's a big piece of the puzzle that we need to make this successful, so we really appreciate it.
This is one of the most rewarding things that I do, that we do in our career, and I just love seeing how we take our team, which are really from all walks of life, really from around the country, and we're able to come together in a short period of time and just, from my perspective, just perform miracles for these patients.
Esté bien sin ningún dolorcito, esto me va a cambiar la vida de un solo día, una sola vuelta de la vida, ¿no? Voy a ayudarla bien porque ahorita antes ellos me han estado ayudando, ¿ves? Sí. Ellos me han estado ayudando, ¿sí? Porque yo no he trabajado nada, ellos me han estado ayudando con comida, con medicinas, con ropa.
Es una generación que nos hemos beneficiado con ustedes.
There's been one really special patient that I got the pleasure of working with. It's one of 3 family members in her family that have received care through Operation Walk. A couple years ago, I worked with her mom. She got a total knee replacement. And then her siblings, 2 of her siblings have also gotten knee replacements with the Operation Walk team. So I think it's just really amazing to see that impact that we have, not only on the patient, but their families.
Y les agradecemos muchísimo porque nos devolvieron prácticamente la movilidad completa en la familia.
You know, when we're here as a team, it's not just about operating. Oftentimes we are working side by side with other surgeons that are here in the country, you know, physical therapists, nurses, and our team is very involved in teaching them, you know, the latest techniques and even just some of the basics of patient care. We also try and be involved in the community, so we spend time in an orphanage, and also the team has the opportunity to visit the maternity ward here at the hospital.
It's just seeing the joy on the patients' faces, the little girls' faces in the orphanage, being able to give to the new mothers and babies, and just being able to give to someone who truly appreciates and also needs what we give. It just really does impact the way we all live in this world and how we all feel about giving.
You look good.
It was quite touched to be there. I think the 4 ladies who run this orphanage, Para las Niñas, you know, they have 18 girls currently there, ranging from age 2 to about 20. They bring them in and they raise them for their entire adolescent period. And it was just touching to see them and how great they were taking care of each other. We were able to help out and provide them medicine and all of their basic needs for the full calendar year, with aspirations to come back next year and help them reload. So they all were also into music and dancing, and so we provided an abundance of toys and some speakers and guitars and drum sets. As soon as we walked in, they ripped them right out of the bag and got to playing and singing and dancing, and that was special for my mom and I to both be there.
We got to play soccer with them, and we got to run around and chase after them and play catch, and they were just so happy to have us there.
It's tremendously impactful for the team to do not only what we do with joint replacements, but what we do within the community as well.
One of the
coolest things happened to my very last patient from last year. She was a rheumatoid arthritis patient that had been wheelchair bound for I think 5 or 6 years, and last year we had to carry her onto the OR table because she was unable to walk. She hadn't used her legs in so long, they were pretty contracted and bent.
Everything went really well with the surgery. She's going to walk very well.
Okay, y dice que con respecto a la cirugía todo salió súper bien y que pronto va a poder caminar mucho mejor.
And I got to see her walking around the unit. Looking so good. It was emotional just to see the smile on her face and see how good she was walking around.
Gracias, yo no podía dejar de venir.
You know, the amazing thing was she came here to help support and assist the other patients that are going through what she went through a year ago.
Just truly moving to think about where her life is today compared to where it was a year ago and what she's able to do today. It made the whole thing come full circle. Really solidifies why we're here, and I can't get enough.
Claro, para mí es una gran bendición, ¿verdad? Llegar a este punto. Sé que todo fue un sacrificio, todo fue un proceso, pero la victoria está aquí y puedo caminar bien, súper bien.
Quiero extender los brazos para abrazarlos a todos ustedes.
It has a very rippling effect. You think about neglected care for not just a couple of years, but maybe even many decades. You're not functioning well. You're not able to work, you're not able to care for yourself, and if you can't do that, somebody else has to do it for you. So most of these patients come with family members that are otherwise caring for them. Children and grandchildren who are not going to work themselves, they're not going to get educated in school themselves because they're caring for the patients. We come here and offer them the opportunity to get a knee replaced. You change a knee, you change the community. So it's not just, hey, I don't have knee pain anymore. It's because I don't have knee pain, I can actually live a very fruitful life, and so can my family.
The thing that keeps me coming back is just the kindness. It's everywhere.
It's a feeling unlike any other. It's hard to describe the fullness and the gratitude you get from the patients here. It fills your heart, and that's why we come back.
The years go by fast, and I look forward to it every year. It's sad to leave, but I know we'll be back here again next year. So I know we give a lot to these people of Honduras, but they give us back so much more.
How could you not love watching somebody's life and their family's life be impacted so profoundly with a surgery that takes an hour and a half? It's an hour and a half surgery, and their lives are completely changed.
Muchas gracias a todos y no se olviden de Honduras. Honduras necesita mucho de personas como ustedes y como el doctor y su equipo.
All right. Thank you. When I decided to retire about 3 or 4 years ago, and it's a 3 or 4 year track, I decided the way I wanted to finish my surgical career was in San Pedro Sula, Honduras, taking care of these wonderful people.
Last 7.5 years, I've been Dr. Beaver's PA and lucky enough to scrub with him on his last day. It's gonna be emotional. I'm ready, I think.
So I did my very last surgery today on just the most amazing woman. Yeah, this has so many highs for me. I saw so many people that came in my room during this last case that were just saying the most incredible things, and it was just so emotionally difficult for me to get through this last surgery knowing that this is my last surgery. That doesn't mean I won't be back here. I plan on continuing to fundraise and to help run the Op Walk Carolinas group and to be back here every year for many years to come.
You deserve the greatest retirement. Thank you, you and Mary, for taking me in as one of your own. I'm proud to be part of your team. Thank you.
When I first got to Ortho Carolina, you get assigned a mentor, and Walt Beaver was actually my personally assigned mentor. Then the best mentor for me that I could possibly have asked for. He's really taken me along and helped me build my practice, and just done some incredible things for me.
Working with Dr. Beaver has been an incredible experience. He's a great man, great surgeon, and Walt, it has been a pleasure knowing you this last 15 years that I've been downtown at Mercy and working with you here at OpWalk. So thank you for all the good times, and thank you for just being an incredible inspiration to all of us. I appreciate you, brother.
I'm really glad that I had the opportunity to meet you, to work with you. In the different trips that we've met, it's been your work, your example has been inspiring to me and to others. We're really thankful that you came down to Honduras to help the people. Thanks for sharing your knowledge and your skills with us.
So Dr. Beaver, thank you. I am who I am today and where I'm at today, beginning with you. So thank you very much. Happy retirement. All the best to you.
Dr. Beaver, good luck in your next chapter. Nothing but long, straight balls on the fairway and big, big, big trout. It's been an honor to work with you. Thank you.
Hey Walt, I just wanted to wish you the happiest of all retirements. I wanted to thank you for being such a close friend and such an incredible mentor over all of these years. I'm really looking forward to your next chapter in life and all the incredible things that you're going to do. We're certainly going to miss you around here, but we're really excited to have you continue to be involved in Operation Walk because you meant so much to the team. Happy retirement.
Couldn't thank you more for all that you taught me over the years, and your friendship, your mentorship, and it's tough to see you go out in retirement, but I wish you the best.
Dr. Beaver, we all know you as the governor, and you've taken care of thousands of people and given them hope and the ability to walk again. Thank you for everything that you've done, and go Tar Heels.
It has been an honor to work with you and to take care of your patients. You are a truly special human, and I am so grateful to have been a part of OpWalk too, and I'm really going to miss working with you. All the best to you, and you take care. You deserve it. You deserve to retire.
Hey, Dr. Beaver, just wanted to wish you a happy retirement. It has been an absolute pleasure of a lifetime working with you and learning from you for the past 7 years. Anytime you want to come hang out with me, you are more than welcome.
Hi, Dr. Beaver. We just want to wish you the best in your retirement. May you and Mary enjoy your family. That's clearly very precious to you. And thank you for the training that you provided to all of your mentees. And that is something that is going to endure for many years to come. Thank you.
Hey, Dr. Beaver, congratulations on your retirement. You deserve it. I just wanted to say, I want you to relax in this retirement. You always would tell me, just relax. And now I want to tell you, just relax. And also, maybe instead of Buenos Dias Popliteas, you'll say adios to the Popliteas and enjoy the rest of this retirement. So congratulations, and it's been a pleasure working with you. Operation